We are the Group 3.
We are here
to discuss about
the importance of nursing in informatics.
So sit back.
watch and listen.
Hey guys! So since our group wasn't able to go outside to film for our informatics vlog because we were advised to stay at home because of the NCOV issue arising, so instead we are going to discuss the importance of nursing informatics in today's generation.
So guys, we will interview that guy over there who's playing basketball. We will try to ask him on what is the importance of technology and informatics. So let's go. Importance sa technology and informatics karon labi nga nanatay issue nga coronavirus unsa day lang importance day.
Well, ang importance sa technology and so ito informatics karon nga ay coronavirus is that mas dali ma-disseminate ang information through social media and it is more convenient kay with just a click of the hand spread na din tag information.
Mo to siya ang importance sa technology and informatics karon nga natay issue ng coronavirus. So, salamat kayo.
Health informatics is also an important part of care coordination in nursing. The ability to track staffing, workflow, and communication can help nurses to identify areas where current processes can be improved.
So this can also help ensure that staffing levels remain adequate, which is critical for providing patients with best possible care. If the nurse-to-patient ratio drops too low, patients are more likely to suffer adverse reactions.
Maintaining adequate levels helps nurses provide the best possible care each day without burning out. Evidence-based practices have long been an essential part of nursing. Today, determining the best practices involves the use of health informatics.
Analyzing the mass quantities of data collected regarding patient care and outcomes help to determine how would the best treat these conditions and solutions in the future. The more data that is collected and analyzed, the more accurate the resulting conclusions tend to be, providing the best possible information for determining how best to care for patients in the future.
The growing role of informatics in nursing has also created a number of new job titles for those with clinical experience and an interest in working with the data.
One of the primary ways that informatics has changed nursing practice is through documentations, in which before they are more likely to use paper charts and are now meticulously changed into handwritten notes. So today, nurses are more likely to encode and input notes into electronic health records and other systems that keeps patients' medical history or records up to date and easily accessible. The Healthcare Information and Management System Society reported that as a result of electronic charting, nurses are more able to obtain information quickly and more efficiently by using the information to improve the daily workflow. So it is more easier, more efficient, and more accurate in using these kinds of technologies.
Informatics is changing the face of healthcare. As technology advances, healthcare organizations and providers are able to collect, analyze, and leverage data for more effectively, influencing the way care is delivered, resources are managed, and teams operate each day. You would be hard-pressed to find an aspect of medicine that has yet to be touched by the mass of collection and analysis of data that has been ushered in by the information age.
Meet Chris. He's a registered nurse in a healthcare facility undergoing many changes in how patient care is delivered, measured, and improved. His position as a registered nurse in nursing informatics gives him an opportunity to design changes in workflow that help the staff and make patient care safer. Nursing informatics is a specialty bringing clinical knowledge alongside information science to improve workflow for many nurses and providers. The challenges have been numerous, but Chris and the clinical team working with him have redesigned technology to help change the pathway for documentation, information, knowledge, and communication within the electronic health record, EHR. The EHR is the actual medical and health record used for documenting patient care. Additionally, it offers knowledge links for staff and allows for communication between providers. Chris's example shows that informatics has helped the healthcare industry overcome several challenges. For years prior to informatics, physicians and their staff were overloaded by the healthcare management requirements of their practices. For one, it was difficult to keep accessible important information, such as the patient health record, the data collected from the health record, and the operational information needed to make decisions for their practices and employees. These challenges often led to patient safety incidents involving missed information, confidentiality and/or cybersecurity breaches, inaccurate reimbursement for services rendered, lack of coordination of care with the patient's other providers, patient's medical care overlooked, need for cost containment, problems in accessing patient record updates, need mobile applications for access to information. Nursing has the responsibility of making sure that care is completed, documented, and that patients are properly educated about their condition and its treatment. Juggling all the activity can make staff vulnerable to errors unless technology makes the patient's record easily available. Decision support, or information and knowledge embedded in the patient's health record, assists clinical staff in making safe decisions. Nursing challenges also include getting information needed about the patients, missing information which hinders safe practice, patient and staff safety, improving quality of care, increased decision support, accurate patient data documentation, finding education while delivering care. Chris's team has used the nursing workflow to create smoother documentation in the EHR and alerts for critical missing information such as vaccines, allergies, and vital signs, thus improving patient safety. Many therapy departments, radiology departments, and laboratory departments have struggled with the same concerns for their technology needs.